guys for joining. Of course, you know my name is Destiny, and I will be talking about how mental health, the different coverages can vary just depending on whatever coverage you may have. For mental health specifically is what I was talking about for my public speaking class. And I can go down the line for days on why our race and age and different things, our money, which is a main factor of how much we can spend on what type of insurance we could get, from Kaiser to Aetna to whatever we decide to pick. But the main thing is that we don't always want to come forth when it comes to mental health, and getting the correct coverage that we may need so that we can get the help that we need as human beings. And it varies from age. They say that the younger kids are, more vulnerable to come forward than adults, just because we get asked the questions more as kids than we do adults, how our mental health is, and that's a big factor. And also I would say for like postpartum, like for myself, I would say I didn't really come forward because I didn't want them to like label me as a mental health patient. Not that I was feeling like suicidal, but just because you have a lot going on with the new baby, and being a parent, that you don't want them to, one, probably give you medication or try to put you somewhere away from your child, for people who are parents. Another thing would be, like I said, was like the coverage cost. If you don't have the funds that you need for coverage, we get put under a factor of just like Medicaid or Medicare, which we don't always get the correct assistance that we need. We know about different insurance, so like Kaiser, you have to get specific coverage from Kaiser because they want their people to go to them instead of going to the outskirts. So it gets harder when they try to get help from other hospitals because not everybody covers for what they're needing, for their, mental health reasons. And has anybody else have any experience of like not being able to get coverage just because of their insurance that they've had?
I worked for people who haven't been able to get insurance, due to their, weren't able to get mental health services. Weren't able to get mental health services due to the type of insurance that they had, or lack thereof.
Right. So it just all depends on what type of insurance you have when it comes down to the bottom of things. It was interesting when I was reading it. It was saying that when it comes to like genders, sometimes they don't like to accept different genders because we have different genders. We have trans, and we bisexuals and different stuff. And I know like my grandparents, they're so like against stuff like that. But the new day and age, like we are more accepting of different genders. But that was interesting to me, like that we live in a day and age where everybody's gonna pick who they want to be, and a lot of coverages don't accept them, or they get like the appointment and they get there and it's like they're uncomfortable. They don't want to be at their appointment because of their mental health, because of their choice of gender, not because of their mental health. So it kind of sucks that people have to deal with that when it comes to different insurances. But I really just wanted to touch base on, the different insurances. I know I have Aetna, and I still don't really know like why I chose Aetna. I think we were just given kind of options, and I'm like, okay, this is one that really probably fits me. And we don't have Kaiser up. I don't think we have Kaiser up there, but just going with Aetna, it's good and it's bad. Like, we work for this company, but I still pay like co-pays and different stuff. I thought I was gonna be able to minimize my co-pays, but I still pay co-pays like when I go to appointments. And like people like with Medicare and Medicaid, they don't always have to pay a co-pay, and that's like a good thing for people who have the mental health kind of, because they don't have to pay for these appointments. Like they get access to like therapy, and like they can do video visits in certain areas. But I know they're changing that.